Hey guys, can you hear me? Can you see me? Just tell me hi and hello if I'm audible and visible. Hello all, am I audible? Am I visible? Please let me know. Okay, good afternoon everyone. So hope you're doing well and I'm Dr. Ranjith. I'm going up with a recall of the second session of Wednesday's NEET PG 2024. I hope your session went on well. Hello Rajaroy, how are you doing? So I think we'll have a quick recall. I have created a stem of a question with the salient features what I have got from students. If there's any error in that, please let us know so that obviously we'll try to pivot it, we'll try to change it and give a better version of record on both the morning as well as the evening session soon for you guys, right? Okay, ready for it? We'll do the same way what we did yesterday. We'll be like fastest finger first. Whatever is the right answer, let us know. Fine. Okay. This is one epithelium. I'm sure this must have been covered slightly in anatomy as well. This is a classical case of a transitional epithelium. So when you see transitional epithelium, it's obviously seen in ureter or a bladder. I'm not sure which was on the options, either ureter or bladder, whatever was in the options, that will be the right answer. If it's ureter, let's go with ureter. Esophagus is squamous epithelium. Trachea is your pseudocyte if it's ciliated columnar epithelium. Stomach is in columnar epithelium by default, right? As a classical urothelium. Just one extra point for you. So what is this cell called as on the top? Because this might come in the next sessions because they have keep on asking normal findings over the period of time. So this is one normal finding which came in this NEET exam. That's your umbrella cells, right? Okay. Next one was a case of an MI, right? So first, was this question there? Just comment yes or no, right? If the question was there, I've got multiple images from all of you guys. So I'll just brief it out so that whatever is the image which comes to you in a session, that will be the answer. If you have seen neutrophils, the answer would be somewhere in 1 to 3 days. I'm not sure if you've seen neutrophils, right? So if you see lots of empty spaces like these, right? Lots of empty areas. If there are lots of empty areas, it's equivalent to the foamy cells. It's equivalent to the macrophages. If it's in macrophages, I would prefer somewhere in 4 to 7 days, or the best option here is 4 to 5 days, right? If it's the same image, I would go for macrophages, and the option would be around 4 to 5 days because some of them say there is coagulative necrosis, some of them say there were neutrophils. So I'm a bit worried about that, right? So somewhere around 7 to 10 days, here you should see lots of vessels. I don't think you had vessels in that thing, right? Okay, 3 to 4, whatever it is, it's somewhere in the ballpark of 4 to 7 days if you see in macrophages. If it's after a week, you will see only a scar tissue, which is going to be pink layer. So I feel the appropriate answer, okay, if 1 to 2 days is not there in the option, I'd go with image must have been had macrophages, the clear area. So appropriate answer would be somewhere around 4 to 5 days. If anything was there in the ballpark, that's the right answer, right? Perfect. Then I'll go with that away. So most of you guys are saying 3 to 4 days. That will be the closest option if it was macrophages. Fine. Okay, this is definitely not within a day. This is wrong. This is absolutely wrong. So somewhere between 4 to 7 days, the closest one, if it was 3 to 4 days, let's take that as the answer. Fine. Okay, perfect. Let's go to the next question. This is an easy one, a repeat one. Quite a few of you said that second paper was a bit tough. Yes, it was a bit tough. I'm not denying that at all. But there is silver lining as well. Questions like these, right? This is a straight up question. You have your classical fishnet appearance. I'm sure you must have seen this image and you must have shouted, yes, we know this answer, right? There's a classical case of an Pemphigus vulgaris, immunofluorescence of an direct immunofluorescence of an IgG, right? Perfect. Okay, great. Okay, let's move on to the next one. This is not a difficult thing, I guess, right? So was this question there? First, please do comment yes if the question was there. And this also is a pretty simple question. If it is A beta, it is definitely not alpha synuclein. Some of you might have mistaken as alpha synuclein. Alpha synuclein comes in your Parkinson's and other type of things, right? It's definitely an A beta or an amyloid precursor protein. Whatever it is, it's a very simple one. A beta or A beta 42, whatever it is, the answer is an A beta amyloid deposit or an amyloid deposit as such. Whatever is that in that term, go with the answer, right? Perfect. Answer C is the right answer. Okay. Next. Was question like this there? Beta amyloid will be the right answer. Fine. Was this question there? Or anything related to this, because there are some students who will recall that it was a pedigree or it was a history, I'm not sure, something related to the incidents in the newborn child, right? Perfect, this question was there, right? So was this the same question? I'll just write whatever is written here. One parent was a carrier, one parent was completely normal. Let's assume capital A, capital A. One parent was a carrier. Okay, for father and mother was a carrier, right? Perfect. So when you have father and mother as carrier, let's put it small a as a mutated thing, right? So the possibilities are capital A, then capital A, small a, then again a capital A, again a capital A, small a, right? So these are the 4 different possibilities of the children. Of these both were classical cases of, it was about hemophilia. Okay, that might change my thing. Okay, got it. If it was hemophilia, fine. Let's change a little bit. See, because if it's in hemophilia, then the gender, everything will come into the option, right? So some of you said mother is a carrier, father is normal, right? So mother is a carrier and the father is normal. So then the possibilities are like this. I'll just change it. Capital X, capital X, capital XY, small x, capital X, small xy, right? So these are the possibilities. Now, of the 50% daughters or the girls, 50% will be carriers, and of the 50% of the boys, 50% of the boys will be affected. So if this was there in the option, that will go to the option, right? Okay, if the option is inverse, it's fine. 50% of the carriers will be girls will be carrier, and 50% of the boy children or the male child will be affected individuals. This will be the appropriate answer if it was hemophilia and something related to that, right? Okay, perfect. Whatever was the closest, that will be the right answer here. Fine, perfect, great. So was this question there? Because some of them said that there was an image on aortic dissection, pathophysiology. The only image which comes to my mind in pathophysiology is the microscopic dissection of the tunica media. Or was it a image on the DBKs or classification of that sort? If there's an image on aortic dissection, pathophysiology, it was not there, it was there. Okay, we're getting mixed response here as well. There's a problem with recall. Some of them might be there, some of them might not be there. If it's there, the answer is going to be cystic medial degeneration or a cystic medial necrosis. Whatever was there in the option, let's go into that. Okay, it is an HPE image. Fine. See, if it's an HPE image of an aortic dissection, it's an histopathological image. The only thing you can see is you can see blood between the layers of media. If you see blood between the tunica media layers, that will be the right answer. A microscopic image. If this image is not there, I'll definitely get inputs from you guys. You can ping me as well in Insta. We'll definitely come back to it, right? Connective tissue disorder. Okay, the option was not the microscopy. Is theta? Okay, there's a clear dissection in the microscopy. Okay, if it's in connective tissue disorder, let's go with the connective tissue disorder. If they're not asking the microscopic pathophysiological image, connective tissue disorder will definitely has a risk of an aortic dissection. That will be an appropriate answer. Fine. Okay, perfect. I'll rephrase this question. We'll definitely come up with an more appropriate recall of both the sessions very soon on the same channel. Fine. Okay, this question was there. If it's not there, let's skip it. Even if it's there, you guys know the right answer, right? It's ovarian carcinoma, CA125 has to be the right answer. This will be definitely covered in the OBG as well. See, Zeus and Mondal, your fibrinoid necrosis finding in a microscopy can be there in any problem of the blood vessel. Fine. Connective tissue disease will be the most appropriate answer. If it's a history of an aortic dissection and a dissection is shown on the microscopy, that will be the most appropriate answer. Fine. Nikhil, that's not in our hands. Hopefully it makes things better. Okay. Fine. If it's a multiple option, CA125, LDH, AFP. Was it given as ovarian epithelial tumor or just an ovarian cancer? Anything of that clue? It was an all except question. Some of them are saying multiple choice thing. Some of them are saying all except question. But all these will be definitely useful in ovarian tumor analysis. Be it in CA125, be it in LDH, be it in AFP, it will definitely help, right? There is a normalization score as well. We'll definitely release a video on how normalization works. If a paper is generally tough, normalization is a little bit on the better side. Let's look into that very soon, fine? Okay, if it's 3, we'll go with all these 3. All these 3 are used in the evaluation of ovarian tumors. If it's an all except question, what is the 4th marker? That will be the all except. 99 was obviously not useful for us. It's useful for an pancreatic cancer, right? That should be the appropriate answer. 125 LDH and an alpha fetoprotein. Okay, next question. Was this there? I just got an thing Marfan syndrome, fibrillin. That was the only recall which I got. I just created a history around it. 22-year-old person, 66.3, 15.5 will be for breast cancer, right? Okay. So Marfan syndrome patient, what's the most probable protein mutated, right? See, there is a very tiny trick here. If the question is, okay, Nashima, understood. If the question was asking which is the protein produced abnormally, the answer is straightforward. It's fibrillin. If the question is asking which protein is being destroyed, That's a problem with understanding in depth, right? Superficially, everyone will know fibrillin, but fibrillin is not the protein which is destroyed in Marfan syndrome. We just now saw an aortic dissection. Elastic protein is destroyed, right? The destroyed protein is elastin, and the absent protein genetically is fibrillin. So the answer will definitely be dependent on what was the wording of the question. Fibrillin is mutated, but because of the mutation, elastin gets destroyed. That is unique about Marfan because they are dominant negative mutations. Fine, okay. Ectopia lentis, everything is there. It's a classical history of Marfan syndrome with a mutated protein. The answer would be fibrillin, as simple as that. Okay, got it. Was this question there? This question, which is destroyed, Nirban has changed the entire thing. See, if the question is which is destroyed, it will be different. Praveen, if it's a poor recall, do help us. We'll definitely come up with a better recall, right? Because you guys sat for the exam and not us. If it's destroyed protein, the answer would, I would prefer it to be an elastin. If it's an mutated protein, I'll go for fibrillin. Okay. Again, these are the tiny differences because you perceive something and you look for that. So answer will be dependent on what the question was asked. Destroyed protein is elastin and the mutated protein is fibrillin. Fine. Okay. If this question was there, was TBIC 550? And I was also told that normal values are given, right? At least one thing NB did correctly was not to make us memorize the TIBC value and serum iron value, right? So if it's a normal value given, this TIBC is definitely elevated, right? It's an elevated TIBC. So in an iron deficiency anemia, the protocol is it's a very simple thing. 53 has to be an IDA. See, here also, hemophilia because of the hemorrhage can result in IDA. So if there's no history of bleeding, I would prefer the answer to be directly IDA, and it's a very simple case of IDA, unless they want to complicate saying that the history was there's a bleeding of hematos and anything, then hemophilia related to IDA would be the right answer, right? If this is simple, it's a simple IDA question. Okay, fine. Okay, was this there? It is a PYQ as well. This guy, I'm sure you'll never forget it. It's a classical acanthocyte. So acanthocyte remembers as only one disease. It's an A beta lipoproteinemia. Okay, fine, Nashim. I'll, if possible, if you have this demo of the question, do let me know. We'll definitely come up with a better recall there, right? It's a classical acanthocyte. It's a classical case of A beta lipoproteinemia. I have added this also in the options for the only reason if some thing again is being repeated. Liver failure is a common cause compared to A beta lipoproteinemia for the same acanthocytosis. Fine, perfect. Okay. This question was there. This is one thing which most of the students said that, okay, the line was not here, line was not there, right? It's a very, very simple one. It's called as an immunofixation, which is a modification of same serum protein electrophoresis. That's all, right? So here it's a simple thing. If you have observed this image just for 3-4 minutes, 30-40 seconds, it would have been easy for you to solve the answer, right? So here I have a very thick color in your IgG and I have a very thick color in the lambda. To be perfect, there's an IgG lambda secreting multiple myeloma, right? That's how it is. Fine. If whatever the dark band is, we'll go into that. I'm not contemplating which is darker, which is lighter in the exam because you guys wrote the answer. If it is an IgM dark band, if it's an IgM thick band, let's go with an IgM multiple myeloma, or an IgA, let's go with IgA multiple myeloma. But the ultimate thing is whichever was darker or whichever was a thicker band, that will be the myeloma appropriately, right? So multiple myeloma with a thicker thing wherever it was, be it an IgG or IG or IgM. IgG is the most common type of multiple myeloma. I'm sure you guys know that. Fine. Kappa is always there. See, kappa is irrelevant for me here because when I have a immunoglobulin secreted, it will have definitely a heavy chain and also light chain. So kappa is irrelevant here. The heavy chain is more important. IgG or IG or IgM, please go with whatever it is. Fine. If IgM is thicker, let's go with an IgM multiple myeloma, as simple as that. Okay. This was there. I'm not sure if this was there. This is pretty simple question. I think they have given you a bit of an push sometimes, at the same time easy questions also here and there, right? If this was there, it is an intrinsic factor problem. That's a simple one, APTT, right? At least with respect to pathology, they have buffered it properly. Sometimes a little bit difficult thing, sometimes a very easy ones as well. Fine, perfect. Let's go to the next one. Was this question there? And tell me whether these options are right. This time I would say the paper was a very, very good paper. Rather than just memorizing few things and vomiting, this was a very good thing, right? So you will have sir, I would require more options for your ovarian carcinoma markers. Definitely in the OBG also the recollection will be there, and please give me other options. I'll definitely come up with a better answer. Fine. So post ileal, this is a perfect thing. So post ileal, you need to have an idea of vitamin B12 being absorbed. So the patient will have a vitamin B12 deficiency. Till previous exams, they would have started with the vitamin B12 deficiency. Now it's not that. Now they're wanting to know you what are the features in vitamin B12 deficiency also, right? That makes it an amazing question. So this type of integration, if you guys start learning from now, it'll be very, very useful for you when you sit in front of a patient, right? It's a classical case of post-ileal resection. B12 deficiency will be there, will be there, will be there. Obviously, it will be macrocytic, right? It is a very simple question, but sitting in an exam hall trying to relate it, correlate it, and trying to find the correct choice might have been a little bit tougher, but please tell your juniors to solve more scenario based questions because the exam is moving towards that, right? So it's a very simple question. The answer is to be all except microcytic hypochromic anemia will not be seen. Perfect. Was this question there? And please let me know the options as well. Okay, because looking at the pattern of questions, there are few things called as in gelatinous transformation and bone marrow atrophy as well, right? So these two are a bit difficult for an undergraduate to pick it up. I'll be very honest, it's very, very difficult for an undergraduate to pick it up. I hope they didn't give that bone marrow biopsy, because bone marrow atrophy and gelatinous transformation of bone marrow can come in almost any cancer, be it a multiple myeloma or a leukemia, right? Was splenomegaly there? Because splenomegaly is kind of moving me away from multiple myelomas, right? So here, you have a 22% plasma cell, which proves for me it's a myeloma. So if this history is there, the natural course of my thought process will be an amyloid deposit. And if it's an eosinophilic material deposit, like most of you guys say, okay, it's fine. If it's more of eosinophilic material, it might be predominantly an amyloid deposit. In that focused area, your plasma cells should have been somewhere else, fine. Okay. Okay, myxoid degeneration. Okay, I'll remove this and maybe I'll add myxoid degeneration, right? So because since the questions were a little bit somewhere on the tougher side, it makes me think twice. Will they ask a very simple question of amyloid? That's all. But my first possibility is definitely amyloid. 22% plasma cells, pink eosinophilic material. I would think of an amyloid, and with organomegaly will definitely more in favor of an enlarged tongue will be more in favor of an amyloid. Fine. Okay, perfect. Okay, so this is an amyloid secondary to a multiple myeloma. If this is the representative image, it's fine. Okay, caseous necrosis, fibrinoid necrosis, bone marrow atrophy. Fine. Okay, I'll definitely come up with all the right answers in the separate recorded version of both session 1 and session 2. As of now, the answer superficially looking, it's amyloidosis related to your multiple myeloma. Fine. Okay, was this question there? The first thing is have to ask this question was there or not. Narasimha, what? No. Something related, so some random history of a factory worker. Was there a history of factory worker? Which factory they worked in? Okay, I'm talking about the session 2, so I hope it was there. Some history of breathlessness, lung biopsy showed a classical asbestos body, right? Yeah. Okay, so classical asbestos body, maybe not this exact image, something related to that. Fine. It is theory question and no image. Fine. So it's no image here. I'll add on to it. Fine. So it's theory question. So it's a classical history of an maybe a pneumoconiosis or a lung disorder, interstitial lung disease with a dumbbell shaped structure. You're going to think of an asbestos body, and I'll go with asbestosis. Fine. Okay. It's an HP image of an asbestos body, not mentioned as a factory. Okay. Okay. One working in industry. Fine. I'll take all your suggestions. Yes, if image was there, something similar to that. If the dumbbell shape thing, let's go with that. Fine. Okay, doctor. Fine. Okay. Next. Was question related to this there, or is it related with orthopedics? Did Dr. 𝐒𝐿𝐴𝐂𝐝 talk about this? I was told that it's a diaphyseal tumor. Was an X-ray there? See, this is what's happening. They're trying to integrate subjects. No more like anatomy, physiology, or biochemistry or 19 subjects. It's an integrated medicine. So you have to know to diagnose first the diaphyseal tumor. See, Thakur, diaphyseal tumor unlikely to be an osteosarcoma, right? That's the first thing, right? Was there a microscopic image of HPE or was there an X-ray image? Okay, I'll take 15, 17 as one more option. There's no X-ray, fine. Let's no X-ray. Was it a microscopic image? Okay, images of a biopsy. Was it round cells? See, if it's a diaphyseal lesion, I would first think of an Ewing sarcoma in a young person. And if it's a round blue cell, definitely more favored towards Ewing sarcoma. If it's more favored towards Ewing sarcoma, I'll think of a translocation between 11 and 22, right? Small blue cells, diaphyseal lesion, young person has to be Ewing sarcoma. That's a first thought by default, and 11-22 is the most appropriate answer. Fine. Okay, EWS related or this translocation between 11-22, both should be more or less the right answer. Fine, perfect. 1517 is not the right answer, Doctor. 1517, you guys know it's seen in APML or your acute promyelocytic leukemias. Fine. Okay, let's go to this. This was there in the first paper. I knew it was there in the first paper. Was this in the second paper also? It's a simple question, right? Post gastrectomy, the guy which is going to be reduced absorbed is B12. I don't think so. This was then a second paper. Vachna, we did discuss this a little bit before. Just go back after the recording to the first thing. Fine, let's ignore this. This is not the second paper. Let's ignore this. Was this image there? I'm sure Dr. Sandeep will also talk about this image in endoscopy. If this image was there, diarrhea, blood and stools in a patient admitted to the ICU, this is a classical example of an pseudomembranous enterocolitis. Fine. It's a pseudomembranous enterocolitis. If microscopy was there, you have the volcano-shaped lesions. That's where you have lots of the pus points, everything coming outside, the neutrophil, necrotic debris, everything coming outside. It was a multiple image. Okay. There's 4 endoscopic image, but I think you must have definitely seen or noticed the yellow color discoloration, which is nothing but the pus points. The pseudomembrane, right? The infectious membrane kind of forms like a membrane. That's called the pseudomembranous enterocolitis. And that's a classical answer of a pseudomembranous enterocolitis. Fine. Yes, perfect. Was this question there? This was in first paper or second paper? Because this was a very difficult one. Vachna, we have discussed that hemophilia question. 50% of the men will be affected or guys will be affected, 50% of the girls will be affected, right? It was in second paper, right? Okay, this is a very, very difficult question. I didn't know why your NB has to choose this option. This was there from an NEJM article, to be specific, from the Twitter of NEJM. I don't know what NB examiners are going. We thought we are only wasting time in social media. I think they are also wasting time in social media ultimately, right? This is a classical pick of an cutaneous malakoplakia. It's very, very difficult for an undergraduate to understand malakoplakia happening in skin. This is a review article, right? Balukados, if you answered this wrong, don't worry. It's fine. Because these are not for an undergraduate. Malakoplakia in a bladder is for an undergraduate, undoubtedly, right? Malakoplakia in a skin is for a postgraduate or maybe for an person in super specialty, right? So this is a classical picture of a malakoplakia, fine? And this is your Michaelis-Guttman bodies. Maybe if you have a very difficult question like this in the future exams, please go in backwards, right? Please go backwards. Look at the options. Malakoplakia, I'm sure you know Michaelis-Guttman bodies. See if it looks like a Michaelis-Guttman bodies. See if it looks like a pyoderma. Are you having lots of infection? See if it looks like other options, right? That should be the thing. So here, there's a classical case of a cutaneous malakoplakia. Unfortunate question to be asked. Definitely, if you have made this a mistake, ignore it. TB, right? TB is our national thing, right? So it's fine. It's fine if you made a mistake. But TB, you don't see any granuloma here. So unlikely to be. This is a classical case of a cutaneous malakoplakia. Fine. Okay. Yes, malakoplakia actually is a problem of the macrophages. It's a chronic inflammation where the macrophage fails to do the job. So it can happen in any part of the body. Though common, it happens in your bladder. Fine. Okay. No, I couldn't get the question, so I just used the image. That's all. Okay. P, I would go with amyloid because there is a history of multiple myeloma, 22% plasma cells, right? Can anyone fill me up with this question? 2 regarding your PNH. 2 regarding PNH. Investigation of choice for PNH is definitely flow cytometry. That is by default the best thing. Gold standard is flow cytometry. Can you fill up the other options as well? So it will help me. You didn't add on this one. Investigation of choice being flow cytometry looks like a very right option. That should be the right answer. I think you guys also not recollecting the wrong answer. It's not inherited for sure. It's only acquired intrinsic factor defect in hemolytic anemia. Sucrose lysis test was used. It's not used now for diagnosis. It's definitely not used these days, and it is episodic. See, I won't call it an episodic. I'll call it a paroxysomal because of the evening time. Episodic is a term generally given for G6PD deficiency. It's an acquired intravascular hemolysis, and investigation choice is definitely flow cytometry. Fine. You guys have given every points regarding PNH, so I'm just going to go with this. Hopefully, because most of you answered this as the right statement, that will be the right statement, right? Okay, hopefully, Sumer. Was this question there? I'll just leave with this question. That will be the last one. I collected close to 21 questions. There were 22 to 23 questions in the first session as well. We'll combine all close to 45 questions in a new video. Fine. If this question was there, let's go with it. Or was this question mistaken for the first thing? It was not there. Fine, let's ignore it. Fine. If it is there, it's your classical clue cell and your diagnosis, bacterial vaginosis. Fine, let's ignore it. Fine. So thank you guys for your time. Have an amazing year going forward. You guys have done an amazing job in respect to the NEET exam. If you guys have done a decent rank or a score in this exam, you guys are already doctors. Please be make sure that the NB is testing the doctor in you, not any more student testing. I hope this trend continues because we want efficient doctors and not students. Data is available everywhere, right? And I hope you will become amazing doctors. Hope to work with some of you guys in future soon. Thank you. Bye bye.